Let's turn our attention to this story. A picket led by the Medical Advisory Committee from Chris Hani Baragwanath Hospital is set to get underway. The demonstrators are calling for urgent government intervention on numerous issues facing public health facilities. Our senior reporter Malungelo Booi is at Baragwanath Hospital. Malu, good morning to you. What is the situation where you are? I imagine anger boiling over, particularly from healthcare workers who work in that institution.
I'll tell you this, Coley, some of the healthcare workers, in fact, these are two groups of people that are taking part. So the ones that are not wearing their uniform are the people that we found here protesting. It's some of the people actually they're saying that they were part of the extended public works program that were working at this particular hospital, and their contracts were apparently not renewed. Now they have joined the ones, the clinicians that were meant to protest here at around 11 o'clock. And you can already see some of the clinicians, essentially. They are out here. In fact, they are protesting. As you rightfully pointed out, Toli, I mean, they're protesting over the many problems that this particular hospital has. And as you would know, Chris Hani Baragwanath Hospital is the third largest hospital in the world and the largest hospital in this part of the equator. And some of the problems, though, that this hospital currently has, I mean, one of the things that the doctors or the clinicians that are here are raising is the issue of staff. And we know that they're saying that the health department here in the province, Koli, wants to release at least 800 workers from this hospital. They want them out. Essentially, their contracts are not going to be renewed. And the clinicians and some of the staff members that are currently protesting here in this, outside this hospital this hour, are actually saying that this is not good enough. In fact, I want us just to really just read some of the placards that some of the clinicians have. If you look at this one, Koli, it says, "Stop stealing public funds. Use public funds to capacitate Chris Hani Baragwanath Hospital," which is something that's very important, and that's one of the things that these clinicians are complaining about. Who will care for our patients? I mean, it talks to the issue if those 800 staff members their contracts are not renewed. Who will then care for those patients? And also, one of the things that's clear about Chris Hani Baragwanath Hospital is that if you look into the staff and the patient ratio here, it's actually quite low, and this hospital actually sees more patients than any other hospital in the country. And I've been told, Koli, that because of the situation at Charlotte Maxeke, that this hospital now has had to take more patients in order to be able to deal with that particular issue. I'm trying to see, Koli, if I can be able for us to listen in to a conversation that one of the academics is interacting with some of our colleagues here. Let's quickly take a listen in.
Referrals from Mpumalanga, from the Free State, from KZN, from all over the country. And by the way, we also get patients that come from beyond our borders. And this is what we deal with, because people realize that this is the last place standing. Even with the fall of Charlotte, after the burning of Charlotte, and the problems elsewhere, all patients now stream here. You don't have to make an appointment, you walk in and you will be seen. So what has been now, making this place to survive is the human resilience. It's the professionals that you find here. The caliber is such that people overstay. They don't say that we're working from 7 to 4 o'clock. They go beyond the call of duty.
So you're facing a health crisis here?
You know what? This is a health crisis of another dimension, of which if our colleagues at head office and our colleagues at national do not pay attention to it, then I can tell you, then we are sunk. not just this hospital, but me and you and everyone. It means we are sunk.
Right, Koli, you can essentially hear then that whatever that is happening at this particular hospital really will lead to real health crisis in this particular hospital. And he was also saying that, in fact, some patients essentially walk in this particular hospital and it's under-resourced, Koli. That's what you're hearing. And they're saying that they cannot afford this hospital not to have those 800 staff being based here in this particular hospital. Koli?
Senior reporter Malungelo Booi, thank you very much. One of the largest hospitals in the southern hemisphere, not handling patients, and not only from South Africa, but from beyond our borders.